Tell me about your symptoms before the surgery.
Oh, I was in constant pain. There wasn't enough pain relievers to get me through the day.
How long has it been going on?
About 10 or 12 years.
Okay, describe your pain and daily
I
activities.
had a real bad tightness in my pelvis and in my lower back and my spine. It felt like there was a vice on my spine, on my lower spine. Sometimes it felt like I would almost break in half if I moved just right.
Yeah, that is when we noticed that you had a what we call degenerative disc disease. Practically the disc was gone. Bone was riding the bone.
Wow.
Bone was grinding the bone, and those symptoms you're describing is when bone is hitting the bone and periosteum. The skin over the bone is very sensitive.
Yeah.
And that is when you had that pain that you just described. How long was it as bad as just before the surgery? 4 years? But,
years. Yeah, it was really bad this last year.
Okay. Now, especially pain in your daily activity and pain in the hip and the leg. Can you describe it a little more in detail?
Sometimes I would even limp a little bit. It hurt. My right hip would feel like it was on fire at times. It hurt so bad. Riding on a riding lawnmower and things like that. It just, it was really debilitating.
Now, the surgery was yesterday afternoon. We are not even 24 hours.
No.
It's long before we are 24 hours after the surgery.
Right.
So, but you told me that there was something about the pain in your hip and the legs and so on. Tell me what.
Right. It's gone.
Yeah.
Obviously it's still early, but I was walking. I went for a walk about 5 or 6 hours after surgery.
Yeah.
And then,
so it's the same day actually.
Oh,
yesterday. Yeah.
And then again. I don't know, about 10 hours later, then I was able to walk for about 15 minutes without any assistance.
Yeah. And this is why you're ready to go home. Your paperwork is done.
Great.
Yeah. But this is not how a spine patient usually feels so short after the surgery.
Sure.
And the recovery is much longer in a surgery that is 5 hours, and we have to literally fillet you open and cut lots of bone.
Right.
And the reason you feel better because we didn't spend all the time to cut the bone, cut the muscle. As a matter of fact, your surgery was about half an hour.
Yeah.
That's all what my part was.
Yeah.
And your blood loss was in a few tens of cc's.
Right.
Yeah.
Right.
You told me about a friend of yours that had an old-fashioned surgery. Do you want to share that with us?
Not that long ago. He had it done a couple years ago, and he's still
struggling.
Yeah, it never was right. It's never been right.
Yeah, but mostly is because probably the job of the fusion is done, but it's just the damage that the surgeon caused on the way of getting in and getting the job done. That is, I think, makes it different. In other words, in a way, this is a surgical strike, meaning that going there, precisely doing what we have to do without causing too much damage to the surrounding tissue, whereas open old-fashioned surgery is like dropping a napalm and a bomb to just destroying too much tissue.
This surgery was recommended to me about 10 years ago, and I refused it at that time because I knew what that procedure was.
Yeah,
and I specifically agreed to do it at this time just because of what you had explained.
And it's a good thing because 10 years ago we didn't have this procedure.
Right.
This procedure was invented actually about 9 years ago.
Oh wow.
And it has been popularized about 7-8 years ago.
Yeah.
So we have still. Certainly, we have some healing time to go.
Right.
But
I understand.
Just looking at you, you seem comfortable.
Oh, I'm very comfortable. Yeah.
And this is not what a spine surgeon is used of his patient after a fusion surgery.
I think last night I went about 7 hours without any pain medication.
Excellent. Well, thank you so much for the interview. I really appreciate that.